So again, when you
This is for aerosol therapy. Different setup.
So it comes as our kit. We'd end up having the nebulizer, and again we would fill up our nebulizer with whatever medication we need to, based upon whatever the order is. I would typically end up using a mouthpiece on most patients. And what you want to do is you want to position this so that you're not touching it. Okay. So this way then this acts as a reservoir, collecting any medication that is not being ventilated in. If my patient is unable to use a mouthpiece, I can attach this to an aerosol mask, strap it around the back of their head. And if I have a patient who has a tracheostomy, what I would need to do is find some sort of a cap, in this case my highly sophisticated mechanism, and some tape. So now as they nebulize, I can hook this up to my trach mask. And depending upon how close they are, you can actually shrink this tubing down or expand it out. But when it nebulizes, it doesn't get leaked out that way.
You don't want a reservoir for that?
Down here.
Oh, that's just it. Oh.
And as it nebulizes, it's going to also just
Come out.
miss there too.
Okay.
We talked about them in class, but the one we would use for pentamidine or for some antibiotics, where I end up having a built-in one-way valve, so that as they inspire in, they can't exhale back out this way, it can only go back out through the filter, and it's trapped so that we're not rebreathing. And then there's the circular, which has the ability to go ahead and retain medication here also to have a better deposition in the process. Questions? So again, we're going to monitor the patient's respiratory rate, monitor their heart rate. Don't want to see the heart rate go above 20. Change. And then monitor their breath sounds. If there's any adventitious breath sounds, we're going to do it at the end to verify what happened to them at the end. They resolve. Monitor the work of breathing, subjective relief. Okay. Should be cake.
If we're hooking them up to that, are we putting the tape on there?
Yes.
Okay.
Sometimes you can find a cap or something to put on there. I don't think I have one handy here though. I mean, it's a sophisticated method, but it works.
Okay.
Process. One thing you want to make sure of is not to do this. It goes the other way around. So this is acting as a reservoir. So that.
So you'll give us a scenario saying that you have to do a treatment with an antibiotic, and we'll have to know.
Well, I won't go that far for
Oh, okay.
But just as far as the different interfaces, 3 different interfaces.
Do I have to hook it up to a nebulizer for it to start misting?
We'll have some safety.
Wait, so you're telling us what medicine?
We'll tell you what medication to use, and we'll tell you the type of patient that you have.
Okay.
So you need to select the proper interface. And you'll also have to know what the complications and side effects and dosages and all that kind of stuff is. Okay. Questions?